In family practice, we see a lot of adult mental health. They come in, they tell me their story, and this is usually somebody who's against taking any medication, does not believe in counseling, but is no longer able to function. They're crying all the time, they're not doing well at work, their job is in jeopardy, or it's affecting their marriage. Before the adult mental health module, I didn't even know what to do when I saw these patients, other than reassure them, tell them to go for a counseling. That was pretty much the extent of what I did. And beyond that, I really didn't know what to do.
Physicians feel like they're on their heels when a mental health problem presents, and they're not sure how to approach it, where to go, where to begin, and how to offer help.
The adult mental health module really gave me the tools to be able to make positive changes, to empower patients, to teach them, and to work with them. So now when a patient comes in with depression, I know exactly what to do. The module taught me when to use a PHQ-9 and a GDA-7, different tools that I was using before but not consistently, and I didn't know when to go to them. And then they also taught me about mindfulness, which is something I didn't even know about before the adult mental health module.
Where we want to help physicians get to is to have essentially an approach, beginning with support and listening, and then diagnosis, and then what we call CBT light, some counseling and cognitive behavioral therapy that's appropriate for the patients.
I listened to them, I objectively measured their depression, and then depending on what they've said to me, I offer them what I think they need, whether it's medication, counseling, and some type of psychotherapy that I can do.
A physician can't necessarily cure the problem that's presenting, but they can be a huge resource and help patients come a long way.
One patient in particular, I remember, came in and said that they were driving and they just felt like they were at the end of the road. He saw that he was scoring extremely high and that he needed help. I started him on medication. He was more open to that. I set up a follow-up over the telephone. I told him about different types of counseling. I reminded him about being in the moment. The fact that I'd called him made such a huge difference, and he felt like he wasn't so alone anymore. And he's done extremely well. He has gone off the medication after, took about a year or so. He did the counseling, and he's happy now. And he even said, he came back and he said, I've never been happy before, and I didn't even know it. And he's had a good relationship now with his kids, his wife. And so that's a huge difference. And I see that over and over again.